Affordable Care Act, aka the Obamacare,
Yeah.
certainly has nothing to do with the current Medicare for seniors, the current
Yeah.
system.
So
Has
one
very
problem is
little
we
to
all have no
do, in
clue
a
what it
sense,
is.
with corporate
Mm-hmm.
care. So if you are um, insured via your employer, that really wasn't
Mm-hmm.
affected as well. It was basically set up for those who don't have coverage either through Medicare because they're elderly. Medicaid would be another one for those who are um, in a financial straits or they're in a situation where they can't get insurance. Um, but it obviously has nothing to do with dentistry.
Yeah.
The
So give
You have
us
to
the
think of the
basics, maybe. Can you
forces
give us the basics?
are operating
Mm-hmm.
against any sort of nationalized healthcare or national healthcare program, universal healthcare
Mm.
uh, uh, programs are vast. I mean, it's trillions or a trillion, I think, is approximately what a part of the economy, what healthcare is, and that includes insurance companies and pharmaceutical companies, etc. And they and many of the Republican money holders have on purpose have created a lot of confusion, a lot of
Mm-hmm.
misinformation relative to healthcare because what they want to do is they want to preserve a healthcare system that is for profit.
Mm-hmm.
And I think that would be excellent if it worked. We haven't seen any evidence that it works. We've tried so many times to keep this for-profit healthcare
Mm-hmm.
system, and it just is not functioning very well. And matter of fact, we are going backwards now. Just as a comparison, so Australia and Canada pay about for healthcare, universal healthcare, pay about $4,500 per person.
Per year?
We're yes,
Mm-hmm.
our system is in excess of $10,000.
Mm-hmm.
So where does all that money go? Well, that money goes to paying for high dollar pharmaceuticals, $100 for a bag of saline solution,
Mm-hmm.
etc. There's so much waste in the system. Also, as far as the administration of the system, uh, Social Security and I think Medicare as well, their operating costs are very minimal compared to when you go into the for-profit healthcare insurance or the insurance that
Mm.
most of us are familiar with. If you had a corporate coverage, and
Mm-hmm.
in some situations, I certainly haven't had corporate coverage, and at one time I remember paying Cobra, and it was more than my mortgage, and I'm trying to raise a 10 and a 12-year-old at the same time.
Mm-hmm.
It was very much taking a huge amount of resources that I was trying to build up for my children to go to college and also to be able to save for retirement. But
Mm-hmm.
at the same time, I'm throwing more money at that particular point when I was outside of the market into a healthcare system.
Yeah, and I grew up thinking that the United States had a free market healthcare system. But when I grew up and had to use it as an adult, I realized that that's not the case at all. So, a few things about it that are not free market. One is there's no price competition, right? You never see ads from hospitals saying, hey, if you ever get appendicitis, we'll take your appendix out for $12,000 less than this other person,
Right, right, right.
Also, nobody at the hospital knows how much anything costs, but they tell you to do stuff anyway, right? They'll just say, okay, go in that room, sit down, we're going to do this thing to you. Then later you get a bill for $700,
Right,
but no one told
right,
you it was going to cost
right.
$700. Sometimes they give you false information, not because they're lying, but just because they don't know. Like I was once told I would definitely not have to pay for a procedure, and then I got billed $100 for it, which was not pleasant. And so that's definitely a non-free market aspect because already we don't have a choice really about what we're buying. You know, nobody presents you with a sheet and
Right.
says, "Well, here are the procedures you could get. Here's how much they all cost. Now pick something." And if you ask a doctor why don't you do that, the doctors would say, "Well, there's a standard of care, right? You as a doctor are there's a standard of care you're supposed to meet. You're supposed to give someone a certain range of services relative to certain conditions." And it's not really up to them. You know, they
Right.
sometimes people have an ethical objection to a treatment, or they just don't want treatment at all. But on the whole, what doctors expect from their relationship with patients is, okay, the patient has this problem, the standard treatment is this, that's what they're getting, you know. And that's mostly what happens even if people can't afford it. So it's not a free market system at all. Can you imagine it could become a free market system, or would that just be way too complex and confusing? And
well, we haven't seen any Western democracy approach it from that way.
Yeah.
And they are certainly, as I referenced Canada and Australia, they're paying less than half the cost that we are. So is there portions of healthcare that are privatized that will work? Yes, but I as you and I've discussed before, if you're unconscious or
Right.
you have no choice, and most of the time you have no choices in, as you say, what those services are. So I have a similar example where I get a bill from a lab. I didn't have any business relationship with this. I had no
Right, you don't
choice
get to
of
choose the lab.
anesthesiologist
Yeah.
that I have or the lab that it goes to. There's no
Yeah.
control, as you say. There's no control on competitive pricing on that. It really is. It's very difficult because the complexity of going out and shopping for your health care previous to a condition that you're not even sure what the extent is a pretty difficult thing to do. It's not a computer, it's not a car, it's your health, and everybody doesn't want to get sick, and they don't want to die any sooner than they have to, and so you have this unlimited wants,
Yeah.
and it's very hard to be able to put that into a for-profit model. And again, if somebody has it or some portion of it that will work, that's excellent. And to a certain degree, eyeglasses and dentistry may be okay in that perspective because usually it's not an emergency situation. But the second you get into complex health problems, you have no control over the entities that are involved in your care, and there's no way you can be shopping for that on a basis of we're going to be comparing and they're going to be competing against each other for your business. That just isn't going to happen.
Yeah. Especially in those cases where someone collapses on the street and they just bundle them into an
Right,
ambulance
right,
and take them somewhere, you know.
They really don't have the opportunity to be
Take me to the cheap hospital.
choosing which widget that they want is going to be best for their budget.
Yeah, so that seems like a reasonable area to collectivize risk, right? Because we all know something health related is going to happen to us at some point in our lives. Even if we're 100% healthy until we die, we're still going to die, and then that's going to need some management, you know.
Right.
So, yeah, I feel like that should be kind of a no-brainer that we all agree to just make a system that's pretty simple and comprehensive that we're all paying into.
Well,
And we all get the benefit of.
well, I think we should throw every American into the risk pool, and that, as you already mentioned, healthcare, your needs for it vary throughout what period of your life. So, as a brand new infant, absolutely. As a mother who is in her childbearing years, you're going to need healthcare more than the 35-year-old guy because he's not the one that is bearing the children. And then, as you mentioned, via age. So it is also a great cause of the inequality in the United States as well. Because there's so many people in where we're moving. So what the ACA did was really help lower the percentage of Americans that weren't covered. So, for example, in Texas, at one point, 25% of Texans weren't covered by any health insurance whatsoever. I think they got, with the help of ACA, they got down to about 12, 13%. But again, it was never meant to, as you say, be an end-all and a cure-all.
It was a step.
But it was
towards
a
something.
step in the right direction.
Yeah.
And of course, as we know, it's been so demonized and confused and had billions of dollars in propaganda thrown against it that there's so many Americans, first of all, have no idea what positive effect that it did. And secondly, they, because of some of the mechanisms built into it, it was still for profit that it still seems that the costs were going to still get out of hand for most Americans. So as I said, I haven't seen anything that's going to work other than the models of, as I said, Western Europe, Australia, Canada, Japan.
And they all do have slightly different systems, right? I mean, like the Canadian system's not exactly the same as the British NHS, and Germany has something a little different. You know, they work out their
Right.
own model a bit.
Yeah, I claim to be no expert on comparing the British system to the Australian system, but the one I've heard the United States compared to most that may work is the French system. I think they
Oh.
still have, as I recall, some private insurance,
Hmm.
but again, it is still universal health care.
Yeah, interesting. Yeah, I don't know anything about the
I
French
did look up the physician compensations in Australia, and I was surprised how high they were compensated, even though they have universal health care.
system.
And so it's not a situation of where we can create our own system, and it's regretful if it was 1961. Americans usually lead the world in innovation. We are now following the world, and so many countries in lack of scientific knowledge and curiosity, healthcare, industrial techniques, etc. We were that exceptionalism, at least to a certain degree, before we went to the moon, and now we are basically a following company or country that seems to foster a lot more ignorance than we certainly had in past years.
Do you